All right, I'm going to go ahead and get started. Give your cards to one of these two folks. All right, this is the Educators Boot Camp, obviously, and we've already started. We decided to just try starting with a different way. So the goal today is to really kind of give you all a sense of the different things, different ways or different methods in which you could be teaching. The agenda is on the table. I just want to do kind of a heads up for this afternoon. This afternoon there is micro-teaching, and so we're going to ask you in small groups to teach a topic. And so you're aiming today towards teaching some topic this afternoon during the session. It'll be 3 to 5 minutes. You can choose what it is. We're hoping that you're using the things that we're doing today. You can do something that you've done before. You can do something new. You can do whatever you want during that time. But in this afternoon, we'll do micro-teaching, which is that you'll teach us something for 5 minutes in small groups. You don't have to like get up and do this kind of thing. So just warning, it's just in groups. It's like 3 or 4. And so that's the micro-teaching for this afternoon. Again, feel free to do whatever you want with that space. So using lectures, not using lectures, doing board stuff, whatever you want to do. And so that's for this afternoon. Otherwise, just walking through the day, we'll be talking about continuing some not lecturing techniques, and then we'll be moving on to the difficult learner, and then really a time spent on how can you teach in the non-clinical setting. And then this afternoon we'll do, and then lunch to work on stuff. Welcome to work on your micro-teaching during that time, and then feedback, and then micro-teaching, then a panel. So that's kind of the agenda for the day. I'm going to have everybody introduce themselves because we've got a pretty powerful group here. I'm Sally Santon. I'm at Virginia Commonwealth University. I just started a bit ago.
I'm Meg Wolf. I'm from the University of Michigan.
And I'm Steve Cico. I'm from Indiana University, so I didn't have to travel far.
Ali Alvarez, I'm one of the APDs at Stanford.
Sarah Williams, PD at Stanford. Danielle Hart, PD at Hennepin.
Jason Wagner, PD at Washington, St. Louis. Ben Schnapp, I'm one of the APDs at University of Wisconsin.
Jaime Jordan, I'm one of the APDs at UCLA.
Rob Rogers, University of Kentucky.
Dave Manthey, Wake Forest.
So you see that there's a lot of us, but that's because we really love this so much. And I feel like every time I'm involved in this kind of thing with this group of people, I learn something. And so it's really, really fun for us too. So we're going to spend the next little bit just talking a little bit more about engaging teaching techniques. As Sally mentioned, really the whole day is going to be giving you things to do, so or giving you techniques to use. So this section is called Not Another Boring Lecture. We do have many of us have Twitter accounts. There will be throughout the day, we'll be sending some tweets out. If you guys are active at all, feel free to follow us, and we can start a discussion about this. We don't have any disclosures. So our goal for this next hour, but really for the whole day, is really to help you create your next presentation using at least one of these techniques. We're going to start by creating a menu of things. It's really kind of like an all-you-can-eat buffet, honestly, today. We don't expect you to get everything, but 1 or 2 things. So don't feel overwhelmed by the sheer amount of stuff that we're going to be covering. So we started with a gallery walk. How did that feel? What did you guys think about it?
I liked it just because, I mean, one, it kept us active, walking around. It was a group, so you didn't feel like you had to be the one to know the answer.
Yes.
Ask someone directly, so that was good.
Perfect. Yeah. So that is a really nice thing about it, is that it does get everybody talking, even the people who might not feel like extroverted or might not feel like talking in front of a whole group. The other thing that we started with was the entry-exit tickets. You guys all filled those out. If you still have your card in your hand, put your hand up and Steve will get it. We are going to be talking about those more later, but the questions that you guys put on there, we're going to be using those to inform our panel later this afternoon. And so let's just take a minute to think about how people learn. I'd like a show of hands. How much do you guys think people retain from lecture? If it's 100%, raise your hand. 90%? 80, 70, 60, 50. You guys are very smart. 40, 30, okay, 30-ish, 20, okay, less than 20. Yeah, So it's somewhere in that 5 to 30% range. They revised this learning pyramid a few years ago to reflect some recent studies that had been come in, and they found that it was really somewhere between 5 and 30%. It really depends on how engaging you are, though. If you're just standing there talking at people and not engaging at all, it's going to be like 5% or less. But if you are at least being a little bit engaging, it's going to be, you could maybe get upwards of 30. But the most important thing to point out is that it's not going to be until you actually have people engaging with the material that it's going to get into these higher percentage of 40, 50, 70, 90%. So really having people engage with the material. So that's what we're hopefully going to be doing with you guys all day today so that some of this sticks. There's a lot of reasons for that. Some of this is probably just people's attention span. So if you see along the axis here that says time in minutes on the bottom, the attention is over here. So learners' attention span starts really high, and then after about 10 minutes, it sort of plummets. And then it kind of stays pretty low throughout the whole thing. And then it's not until the last few minutes that it starts to peak again. The authors of this study theorized that that was probably because that was when the instructor was saying something to the effect of, and the take-home message is, or the test questions will be on, something like that. It's probably a lot lower now. I would be surprised if we even keep people the whole 10 minutes with devices and other things that are distracting people. About 10 years ago, a group of educators suggested that you should have something called an attention span reset about every 10 minutes. So you might have your little mini lecture, and then just as you're starting to lose people, you do something to have them engage with the material and kind of draw them back in. So we like to think about this as just building in opportunities for learners to think and respond to the material. So you can kind of get at both of those things. You know, you deliver your content, and then you're having them engage in the material and helping them retain it a little bit better. Or another way of thinking about this is developing little mini lectures punctuated by learning breaks. So you might ask yourself, where do I start? We'll have a bunch of 2 sessions later on about actually giving presentations and making presentations. So we'll get into this a little bit more, but a few things to start off with. This is called the Kolbs learning cycle. Has anybody seen this before? Yes. Does anybody want to take a stab at explaining what it is? And Dave, I know you love it, so I won't make you do it.
No, actually, one of my colleagues developed this learning moments, and I had to learn about the Kolbs cycle in presenting this.
Fabulous! Can you explain it to us then?
So pretty much you have your active learning, learn something, and then you reflect upon it, thinking about what did I do, why did it work this way, and then you do your conceptualization, like really like what if things would have been different if I did it another way, or just thinking about how just that, and then just doing it again.
Absolutely.
How you would have, or how you would do it again, and if you did it differently, see if that works. So it's a cycle as far as the learning, just really understanding and chewing on it.
Absolutely, yeah, so that's excellent. That's exactly what it is. It's a kind of experiential learning theory, and it kind of walks you through the whole learning process. One of my colleagues, when I was showing this to him the other day, equated to the PDSA cycle, which there are certainly some similarities. But the first thing that you do is you need to activate your prior knowledge. So you get people thinking about the material, and then after that, you give them new knowledge. So then you have some sort of content that they're engaging with, they're actually learning new material. And then after that, they try it out. So try it out in some sort of safe, controlled setting, and then finally you just do it. So you do it in real life. I really like this because it really applies to us in emergency medicine. I think that it is really helpful to kind of think through this process. So anytime I'm doing any kind of teaching activity, I kind of think through this and think about, you know, in that small piece of stuff that I'm trying to teach them, how can I sort of walk them through this? We'll be doing different kinds of audience response throughout the day. Some of it will be low-tech, like our show of hands, or just calling on people. I'm sure all of you have used audience response for one reason or another during your talks. What kind of stuff, like what was the reason that you guys used audience response? Yeah. Great. So yeah, if you're using some of the anonymous polling things, you can get people, have them engaged, have them participate, but they don't have to like be on spot. Absolutely. Yeah.
Maybe to assess like the opinion about the talk and see kind of what side people are leaning towards.
Great. So just sort of poll the audience and gather opinions. Another way to think about that too is to sort of assess people's learning. So if you want to know kind of what people's baseline is, you can use it for that to sort of see how in detail you need to go into a topic. You can also use it for, gosh, did I do a good job explaining that or not? And sort of gauge your audience that way too. So that's great. Good. So I'm going to flip it over to Sally now, and we're going to talk a little bit more about stickiness, I think.
And it is the Not Another Boring Lecture worksheet. We've done the first piece already, and then we're actually on the worksheet, which is this section right here. And so since today, we're actually hoping that you will leave with some sort of a topic that you're going to feel comfortable discussing. I want you just to take a minute and say, what topic are you going to teach? So if you can choose your 5-minute preceptor topic or your 5-minute micro-teaching topic. What topic are you going to work on today? It's at the, yep. Thank you. Does everybody have a topic that they're going to? What's your topic?
I was thinking about teaching some ultrasound procedures.
Okay, ultrasound procedures. Good. What else? Topics? I'm making you commit. If you didn't notice. Go ahead, Kara. Good. Good. Anything else? What else do we have? What? Something similar? Okay, good. And so now we kind of have a direction in which we're going. This is one of the methods for instructional design. It's by Wiggins and McTeague, and it's called backward design. And it's the sense of that you should begin with the end in mind, and so the process is first identify the desired results, and then decide what assessment evidence you're going to use to make sure that they've done it. And then finally, figure out how you're going to teach it. But the point being that it's most important to think about what do you want them to know so that you get them to where you're trying to be. So decide what they're going to do and then go from there. So the first one is identify the desired results. And so that means that, if you're teaching musculoskeletal, are you really teaching them kind of an identify that they need to know about leg calvi-perths, or are they doing an exam? What is it that they need to know about peds musculoskeletal? In the same way, if you're doing ultrasound procedures, what is it that they need to know? And being very clear on that so that you can then align everything along the way to get them to what you want them to know. Do you want to do pair share? Do we have time? Okay. So what I want you to do is pair up with the person next to you and just talk about what's your topic and what are the results that you hope to accomplish in that. I think, Steve, you're joining over here. So everybody's paired. Good. Okay.